Hello, good evening everyone. Thank you for coming first of all, and thank you for waiting for everyone. I think a couple more people have joined us since. My name is Javier Rodriguez and I'll be talking about FIP tonight and the exciting new times that we are all going through. If there's something that's not clear throughout the presentation, or if you just want to bring something up, please feel free to interrupt. And if not, you'll have a chance to ask any questions at the end. So, just to give you an overview of the way the talk will follow, we'll talk about the background of this disease. You'll be pretty familiar with it already. Then we'll talk about how these cats typically present to us, what's their signalment and their history, and what are the most common clinical signs, which are often very vague. And then we'll talk about how this disease goes from a fairly benign presentation to a lethal disease. Then we'll talk about the challenges of diagnosis, and then the most exciting part of the talk will be about the treatment and how are we treating these cats, what are our expectations, and how we monitor these cases. And then, just to give you an example, I'll talk you through a few cases that we've had here at the Ralph, and at the end you'll have again a chance to ask any questions if something's not clear. So this disease, the syndrome of FIP, was first described in the 60s. The first reports are about the effusive form, and it wasn't until a few years later that the causal agent was identified as a coronavirus. So FIP can be caused by both type 1 and type 2 coronavirus, and the prevalent theory behind how this disease again goes from a fairly benign presentation to FIP is about the internal mutation theory, and we'll talk about it a bit more later on. But this theory talks about the mutation that the virus suffers once the cat has been infected, and there's a few factors that have to do with the host and with the actual agent that that causes this development of the disease. So coronavirus are viruses with a large genome, and they have a propensity to mutate very, very easily. With regards to how these cats typically present to us, the majority of the cases will be very young cats, less than 2 years old, and then we have another spike in later on after they are 10 years old, but the majority of cases will be below 2 years old. Some reports have accounted cases up to 70% of younger cats. Then these cats, although it can happen in a breed, there is a tendency to see it more often in purebred cats. These cats often come from a multi-cat house environment, and they may have a history of stressful events, and that is very varied. It can be rehoming, it can be surgery, it can be illness, it can be changes in the hierarchy in the household. So we need to keep an eye out for those things in the history taking. And then the clinical signs that they present to can be very, very vague. Typically we have in our minds these two forms, the effusive form and the dry form or non-effusive form. But there can be a continuum of disease, and the more cats we see, the more weird and wonderful presentations we come across. And most typically these cats will come to us with vague signs like lethargy, pyrexia is pretty prevalent, hyperexia, weight loss and not doing very well. And then you can have more specific signs that are related to the organs that the virus affects more prominently. As to going back to how this disease develops, how we go from feline coronavirus from FIP virus. Again, there are some factors that have to do with the agent, and some mutations have been postulated as causative to begin with, causative factors as to the development of FIP. Later on, this was this was revealed not to be the case. So these mutations, although they can give the virus the capability or the ability to spread throughout the body and to go from infecting enterocytes to infected monocytes and causing widespread systemic infection, they do not necessarily give the virus the capacity to cause FIP. So although they have been identified to be present and to be a factor, they are not the only reason cats develop FIP. And then again, we have this change in tropism from enterocytes to monocytes, and then these monocytes will adhere to vessels and extravasate. Then the macrophages will release cytokines, and they will cause severe inflammation and a strong humoral response. So in terms of what happens, interestingly, when the virus changes from a tropism from enterocytes to monocytes, is that it loses the let's say the ability to shed, so it becomes less infective. As the tropism to monocytes grows, the cats release less, have a lower viral content in the feces. So then the other side of things, so we've talked about the agent factors. We have now the host factors. So the main factors are genetics, for one, and as I said earlier, FIP seems to be more prevalent in certain breeds and also some familial lines, and this may have to do with genetics, although it's not completely understood. One of the reasons behind this is that some breeds, like for example Burmese, have reduced variability of the genes that code for MHC2, for example, and as you have less variability, you also have a poorer response, a poorer immune response. So host immunity is very important. In these cats, there is, when they are infected with FIP, they have an altered production of cytokines, and they have a high levels of TNF alpha, which is believed to be related to apoptosis, particularly of lymphocyte type T, CD8 positive. Which inhibits the cell-mediated response, and cell-mediated response is very important in cats with FIP because it's believed to give to have a protective effect. And also having concurrent diseases, not only diseases that directly affect the immune system, but anything that could cause stress to the cat. Things like pneumonia, things like certain infections, retroviruses like feline leukemia virus could come hand in hand with FIP. So as to how the disease usually happens, both in terms of feline coronavirus and in terms of FIP. So once the cat is infected, the transmission of FIP, of coronavirus, is orofecal. So the cat will start shedding virus from day 2, and normally it will stop after 3 months post-infections. But some of these cats will become permanent carriers, and up to 13% of cats will be in this state. Some cats, the cats that become persistent carriers will continue to shed this virus, the same strain that they were infected to initially throughout their life. Then there is a small percentage of cats that are resistant to the disease, and this is believed to be because the monocytes in these cats are unable to sustain the replication of the virus. Then a small percentage of cats will be unlucky enough to develop FIP, so up to 3% of cats. There are some reports with higher numbers, but this is the most consistent one that you can find in the literature. So again, from a normal coronavirus infection, you will have in a cat that has the right combination of factors, the virus will suffer a mutation that will change the ability to infect enterocytes to monocytes, and then this will precipitate a strong inflammatory and immune response. So how do you diagnose these cats when it can be very challenging? So in some cases it can be very straightforward, or you can start off with a very high index of suspicion from the get-go, just based on history and clinical signs and physical examination findings. But it's not always the case, and particularly non-effusive forms are more challenging to diagnose. So starting from the beginning, these cats will have the right signalment. You will be in front of a young cat, usually less than 2 years old, a cat that may come from a breeder, may come from a shelter, a cat that may have gone through something stressful like rehoming or surgery, or they might be ill for some other reason and just coming to. And then these cats will have the compatible clinical signs. And again, there is a very wide range of signs. More often you will find the non-specific ones, which are lethargy, anorexia, weight loss. We've talked about them. Some of these cats will also present with icterus, and it can be quite prevalent, up to 60% of cats, and that's particularly the case in cats with the effusive form. Then when you examine these cats, you may find that they have single masses or lymphadenopathy in the abdomen. They might have rhinomegaly. Some of these cats will present with neurological abnormalities. Typically, cats with neurological signs will have abnormal meditation. They may have vestibular signs. They may have signs of ataxia, tetraparesis, so myelopathy related signs, and some cats may even seizure, and there is a very wide range of other things that can happen to cats that are affected neurologically. And then FIP also tends to cause very specific ocular signs, and you can see in the ocular form, you can see very marked uveitis, and some cats can develop ephema, some cats can become acutely blind, some cats may have keratic precipitates, which are quite characteristic. And I'm sorry I don't have a picture of that. And then in terms of the baseline test that we have in these cats, often you will have a hematology and biochemistry available, and in hematology you may see a non-regenerative anemia. It's common to see lymphopenia, it's common to see thrombocytopenia. You may see also neutrophilia, but that's not always the case. In the biochemistry, a very common finding is hyperglobulinemia, but again, you may not always see it. An albumin globulin ratio below 0.4 is quite suggestive, but having one above 0.4 doesn't really exclude the disease out. It makes it less likely, maybe, but it doesn't completely rule it out. As I said, hyperbilirubinemia is quite prevalent, and having hyperbilirubinemia without an elevation of ALT, a marked elevation of ALT, is quite suggestive of FIP. Again, you can see that in cats that are septic or cats that have other disease processes, but it should make you include this disease in your differential diagnosis. And then something else that you may come across is measurements of, or that you may want to do, because it's included in in various panels across different labs, is measuring acute phase proteins, particularly alpha-1 acid glycoprotein, AGP. And most of these cats will have very high AGP levels, but again, it's not pathognomonic, or it's not exclusive of FIP. Feline coronavirus serology is not useful in the diagnosis of this disease. As I said, this virus, it's quite ubiquitous. Most cats will come across, will become infected with feline coronavirus at some point in their life, and they may have titers without having the disease. So it's not really useful for us in diagnosing or excluding the disease. And then, if your cat has an effusion, the evaluation, the the laboratory analysis of the effusion is quite important, and more often than not, the effusion will be straw yellow in color. It's usually a high protein fluid, and again, will have a low albumin globulin ratio, same as the serum. You can have variable cell counts. Usually what you find is a mix of neutrophils and macrophages. And then in these effusions, you can perform more specific tests, and I'll talk about those a bit later. Something that we used to do before in practice, and I remember doing this when I first graduated, and we didn't have, in Spain at least at the time, we didn't have many great tests that we could perform, is the Rivalta test, and I don't know if you've ever performed one or seen one. I asked one of my friends for this video. It's a bit shaky, but I hope you appreciate it. So this is a slightly acidic solution, and what they are introducing is a drop of the effusion from the cat. And a positive Rivalta test, what you see is that both solutions don't mix, so the effusion doesn't dissolve directly straight away in the solution that you have, and it creates this particular shape. But again, this can happen with other inflammatory fluids with high protein content, so it's not very specific, but if you have a negative Rivalta test, it's less likely that this is an FIP case, but again, it doesn't really exclude it. So going through some of the things that you may have to do for these cases is imaging, which imaging modalities, and there's not a specific one really, it really varies case to case, but it's common to have, in a cat that you don't really know where things are heading, to have to go for radiographs or ultrasound, and in this you may find fluid in the body cavities, you may find evidence of lymphadenopathy, structural changes to the kidneys, for example, and you may find signs of peritonitis as well. Again, you may not see any of these. And in cats that have neurological signs, MRI can be quite useful, and in this particular study, they evaluated a number of cats that presented with neurological changes and then had a confirmation on histopath of FIP, and all of these cats had changes in MRI. So the next step is the identification of the virus in our samples. So the first one will be in the blood, and there, unfortunately, unlike in other diseases, diagnosing FIP in blood samples is not done. You cannot really do it. So there's a number of tests, and I'm sure that there are more than what I have listed here, that have been developed to try and aid in the diagnosis of this. The first one is one that is commercially available, and you may come across it, is the real-time PCR for feline coronavirus. And this, the problem with this test is it doesn't really tell you that the cat has FIP, because it's knowing that they have coronavirus doesn't really tell you that they have the virus that causes the disease. And being such a prevalent virus, you may see lots of cases that concurrently have the virus, but they don't really have FIP. Some of the mutations that I mentioned earlier on, like the S and M mutation, have been targeted for diagnostic purposes. And again, these are mostly at the moment only available in a research facilities. This is not, as far as I'm aware, this is not widely available, so you shouldn't be able to request this. But they are not great because, as I said earlier, these mutations have been related to the ability of the virus to spread in the body, but not really to change its behavior and become FIP. And then the detection of antibodies, as I said earlier, is not recommended. The detection of coronavirus in effusion is a bit more interesting. So one test that is available now and that we usually request, we send our samples from effusions to Liverpool at the moment, to detect antigen by immunocytochemistry in our effusion samples. You can also do this in tissue samples, like, and I'll move on to that in a second. And it has quite a high specificity, and the difference between this test and the others is that you're actually identifying the virus, the presence of the virus within the macrophages. So that's the difference between that and having a positive PCR in fluid, because again, knowing that there is coronavirus in the sample doesn't really tell you that the cat actually has FIP. Of course, you may increase your level of suspicion if the cat has all of the other pieces of the puzzle are right, and you also have this. You may increase your level of suspicion, but it might not be the way to confirm it. And then in terms of detection of feline coronavirus in tissue, that will be the gold standard. So immunohistochemistry has a very high sensitivity and specificity. Obviously, this requires tissue samples. The performing immunocytochemistry on FNAs, again, has a very good specificity in some cases, but it has a low to moderate sensitivity. The higher specificity has been reported for FNAs of lymph nodes in the abdomen, mesenteric lymph nodes, sorry, I forgot the name. But again, we are finding at the moment that the lab that we used to send our samples for is not currently offering the service anymore, so it might be a bit tricky to find a place to send these samples to, but hopefully it will become available again. Going back to detection of feline coronavirus in effusions, I've only talked about effusion in the abdomen because it's the most common sample that you are able to obtain, but you could also test for the virus in CSF or in aqueous humor if you were to get a sample. The thing is that these samples are very small, and you may not always get the chance to obtain them. So just to go through a few pieces before moving on from diagnostics. The aim of all of these tests is to build your index of suspicion, and confirmation, unfortunately, may not always be possible, and that might not only be because clients may not go for it, you may not have the finances for it, it might be that the case doesn't really lend itself for you to be able to confirm it easily. And again, some of these tests that I've mentioned are not always available, and things change quite rapidly in terms of diagnostics. So it might be that you rely on a test or a certain lab, and when you next have a case, that they are not offering the same sort of diagnostics anymore. And having the possibility of sample effusion and sending it for immunocytochemistry might give you a confirmed diagnosis of FIP. And in the non-effusive forms, you may need to go for immunocytochemistry or immunohistochemistry. So moving on, we have come to treatment. First, I wanted to speak about the options that we had in the past. Before, unfortunately, we weren't able to treat these cases, and often the diagnosis of FIP was a heartbreaking one because you couldn't really go any farther, and you ended up with the having a talk about the palliative use of steroids. People have tried other things, so people have tried human and feline interferon gamma without success, really. Not long ago, this product Betimmune, which has been licensed for herpes virus, was also trialed in cats with FIP, and with varied success. So it didn't really work in all cases, unfortunately. And in the last few years, quite a few studies have come up regarding the diagnosis of and the treatment of FIP particularly. And there's lots of, if you go on PubMed and you do a search, you'll find crazy things about the treatment of FIP, and people have tried many things. But nowadays we have, more recently, we do have some tools available for the treatment of this disease, and some are to do, I don't think I can point here, maybe I can, yes. So the ones that have shown more success are the protease inhibitors. I think it's not showing anymore. Yes, protease inhibitors, which I'll talk about briefly, and then nucleoside analogs, which are the current drugs that we are using to treat our patients. And basically, both these drugs target certain aspects of the replication of the virus, and the first ones that were trialed were these protease inhibitors, GC376 and GC373. This one was trialed in a cohort of 20 cats with FIP. Most were the effusive form, and 6 cats had the dry form. And some of these cats had a clinical improvement, but most of them relapsed, and only 7 cats at the end of the study period were still in remission, which is better than it was before, but still not great. And then this other study was evaluated for the in vitro inhibition of the growth or the replication of SARS coronavirus 2. And they used these 2 drugs, GC373 and GC376, with both were shown to be potent inhibitors of the virus. And then we move on to Remdesivir, which is a nucleoside analog. Both Remdesivir and GS-441524 are very closely related, and they are the tools that we have at the moment. The Remdesivir is the commercial name for that molecule, and is the one that we use in injectable form. This treatment, both the tablets and the injectable, have been shown to be successful in the treatment of both forms of FIP. They have a very safe profile. As far as we know, this is a very new drug, and long-term studies are lacking at the moment, but so far they have been noted to be quite safe. And as I said, they are both, we have both an injectable and oral presentation at the moment. Initially, it was only available as an injectable, so you will have to treat these cats for the length of the course with injections, which was not really nice, and I'll move on to that in a second. And the treatment with these drugs had a very high financial impact, and it's still considerable, but as we have been using it for a while, the price has dropped, and it will hopefully continue to drop. And we are also hoping that other drugs become available as well, which may level the field. And I'll give you a few numbers at the end as to how finances work in terms of treatment. So these 2 articles were the first to describe the use of Remdesivir in cats with naturally occurring FIP. One was a study in cats without neurological signs, and the other one was specifically about cats with neurosigns, and it was quite promising. Most cats went into remission. The doses that were described in this study, that they were used in this study, were quite low compared to what we are using now. So what are our current options? As I said, we have these 2 presentations. Initially, we were only treating these cats with injections, but now that we have the oral, it has become easier. The current guidelines for treatment recommend that combination of both injectable and oral, and the length of the injectable course is quite variable. So initially we were very strict about doing it for 2 weeks. Now it has changed, and we are moving on from that. We might do a week. In some cases we will change the protocol. The injectable form can be given subcutaneous, or it can be given intravenously. When we start the treatment, sometimes we may see that the effusions can get worse, for example, so cats can deteriorate initially, but we will hope that if the cat is stable enough and we continue the treatment, that they will improve. And then you could also go for the oral treatment alone, and the main reason to go for that at the moment will be the financial limitations, because a vial of remdesivir is still significantly expensive, and the tablets are less cost prohibitive. Let's say the length of the treatment is 12 weeks. That's the current recommendation. Again, as we treat more cats and we learn more from this disease, we may change these recommendations. But as of now, this is what we are doing. So how do we treat these cases? So in terms of the doses, we will use different doses depending on the way that these cats present to us. So in, let's say, simpler forms or less complicated forms, we will go for lower doses, and they are quite similar between the injectable and the oral presentation. So for non-effusive FIP, we will go for 10 mg per kg once a day. In cats with ocular signs and neurological signs, we will go higher. So for ocular signs, we will go up to around 15 mg per kg or higher, and neurological signs 20 mg per kg or higher. And if you are using the oral presentation, for example, in cats with neurological signs, it will be better to split the dose in two. And then how do we monitor it? How do we monitor these patients? So initially, you will expect that these cats improve relatively quickly. So they usually improve in 2 to 5 days. And if the cat that you're treating has an effusive form, the abdominal effusion should resolve in 2 weeks, but it might take a bit longer than that. If the 2 weeks mark has passed, you may need to reconsider your diagnosis, or you may need to think whether you are treating appropriately. But if you are quite certain that the cat has FIP, you can either continue with the same treatment or increase the dose slightly. The biochemistry changes, the hyperbilirubinemia, hyperglobulinemia will take longer to resolve, and it can take up to 3 weeks. And then the hematological changes, the lymphopenia, neutrophilia, those might take even longer, but it's not always the case. I'll present a case later on where things resolve quicker than that. We are currently recommending repeat hematology and biochemistry 2 weeks into the treatment, and then monthly thereafter, and then 2 to 4 weeks after the treatment has been finished. It's important in these cats to monitor their weight, because realistically, you are going to be treating very young cats, and they might still be growing. They might gain weight while you are treating them, and it might be that the dose is not appropriate anymore. I already talked about the hematology and biochemistry. You will continue the treatment for the total of 84 days, and you will only stop if at the end both the clinical signs and the changes in the bloods and other signs or changes that you may have seen in your test have resolved completely. If you have only noticed a partial response, you can increase the dose by 3 to 5 milligrams per kilo per day. But if you have to do that, again, you will have to pause and think, am I treating the cat for the right thing? So deciding whether you are still convinced that you're diagnosing, that you've diagnosed the right disease. And then relapse. So relapse can occur at any time after discontinuation of the treatment. Typically, we will expect it within the first few weeks after the treatment has been finished, but it can happen very, very rapidly after finishing the course. And you may see a relapse with clinical signs, but without clinical pathological changes. So it can be quite difficult to diagnose. If a relapse occurs, again, the recommendation would be to increase the dose by 3 to 5 milligrams per kilo per day and complete another 12-week course. And if you find yourself, I probably will be better if I show that later today in a bit, but if you have a cat that has relapse and if you treat them and the cat shows a positive response, you can take that as for diagnostic value. When these cats are having treatment, they can be vaccinated as normal. There's no contraindication as to vaccinations. You may argue that you don't know if the cat may acquire immunity from it, and if you want to be doubly sure, you can do a booster afterwards. They should receive preventatives as normal, and you should avoid surgery in these cats if possible, anything stressful. So coming to the hospital as little as possible. Something that you may see when you're treating these cats is that they may have elevations of ALT, moderate elevations of ALT, and that's at the moment of little clinical significance, although we haven't treated the number of cats, we haven't treated large number of cats in which this has happened, and all of those cats we don't have samples of the liver to know what's happening there. But it appears to be a benign change so far. So some tips about the treatment of FIP. First, you can perform PCRs for coronavirus because they are widely available, but unfortunately they do not confirm disease. It might be a way to increase your index of suspicion, but ideally it will be preferred to go for the detection of the antigen in your samples. There's a word missing there, so that the second line should be feline coronavirus serology is of no diagnostic value. And then when you are using oral meds and you need to go for a dose, it's better to round up, so no to go lower on the doses. I've just put some figures there in terms of treatment. Things have changed very recently because the price of the oral medication has dropped quite significantly. Currently, treating a cat for an uncomplicated FIP, let's say with a 10 mg per kg dose, will be between 1,600 and 2,000 if we're talking about a small cat, and if you're talking about an average 4 kilo cat, it will be about 3 to 3.5, and that will be including not only the drug but also the monitoring after the blood test. That might change if they go to, if instead of happening here, it happened at your practice. It varies depending on your prices. But talking about the RALF, those are the figures that we are handling at the moment. And then if we are talking about cats that need higher doses, like 20 or above, we will go for 2,800 to 3,200 for smaller cats, and 5 to 5.5 for larger cats. And this doesn't include the diagnostics beforehand. This drug is being distributed by VOVA, both the tablets and the injectable. And if you want to get a hold of it, what I will say is contact your local representative for the company. Very good. So I will move on to a few cases. I think we still have some time. These are quite quick anyway, and then at the end you'll have time to ask some questions. So the first case is a 3-month-old female, entire British Shorthair. She came to us with a history of being very dull. She had very marked abdominal distension, and she was pyrexic on physical examination. She had been treated at the referring vet clinic, and she failed to improve with a course of amoxicillin. She was referred to us. We performed a hematology in which we found a neutrophilic leukocytosis and lymphopenia. There was no anemia. The platelets were actually high in these cats instead of low. And then interestingly, this cat presented to us without hyperglobulinemia, and her bilirubin was only slightly high. ALT was actually low. So it's not a typical pattern. You will expect to see that the cats have a higher globulin count than the reference range, but still the albumin globulin ratio in this cat was 0.4. We did a urinalysis as part of our workup. It was largely unremarkable apart from very, very mild proteinuria. This was then rechecked in the future and it was normal. So we performed an abdominal ultrasound in this cat, and apart from finding ascites and a bit of peritoneal reaction, we didn't find any other changes. We took a sample of the fluid, and the fluid analysis showed that it was a protein-rich transsudate. with evidence of with both neutrophils and macrophages. So what would you do in that case? We had available samples from the abdominal effusion, and we had to decide where to submit them to. So we sent them to Liverpool, as I said earlier, and these were tested for the presence of the antigen within the macrophages, and it was, as it says there are a large number of macrophages that exhibit a strong labeling. So this confirmed our diagnosis of disease in this of FIP in this cat. And then we started treatment. This cat was treated with 10 mg per kg dose. We did a 7-day course initially in the hospital, and then she went home with the tablets. She improved quite quickly. Her demeanor improved very quickly. And when she went home, the carers reported that she was a different cat. She had only been with them for a few weeks, and she had always been very quiet compared to her litter mates. So this cat, at 2 weeks post-treatment, still had some changes. So as you see there, the neutrophilia is not present anymore, but she has now developed an anemia that's non-regenerative. And then in the biochemistry, you can see that she actually became hyperbilirubinemic at the time. The albumin-globulin ratio is still at 0.4. The hyperbilirubinemia has resolved at this stage. So we continued to treat her, and then 4 weeks in, her hematology was completely normal, and then her biochemistry revealed very mild elevation of ALP, which is not something that we think it's associated with the treatment. I think this cat had a mild elevation of ALP because of her age, rather than anything else. Obviously, we cannot really say that for sure, but it will fit also the phosphate. It was a bit high in this case. So this cat finished the course and was in complete remission by the end of it. So we move on to the next case. This cat was a 6-month-old male entire Maine Coon. He was diagnosed 6 weeks before presenting again to us with severe bronchopneumonia and bronchiectasis, which we thought was a predisposing factor, and he had improved with a long course of antibiotics. So he was just returning for a routine checkup, and the plan was to perform a repeat CT to see how the lungs were looking. So we did a CT that showed that the cat had a marked improvement in the lung changes, but we also found an incidental abdominal effusion and lymphadenopathy. So in this cat, the effusion again was high protein trastudate, and the lymph nodes came back as pure granulomatous inflammation, which is quite typical in this disease. It's one of the hallmarks that you will find in tissues. In this case, we had a very high index of suspicion, as you imagine. There were some financial limitations at the end because this cat had 2 CTs, a long stay in ICU, had to receive oxygen therapy for a long time, and had been on antibiotics for quite a long time. So we had a chat with the carers, and we discussed the benefits of trialing treatment without pursuing further diagnostics. And in this case, the carers decided to try treatment. We started with a 7-day course of the injectable Remdesivir, and then followed with oral GS tablets at 10 mg per kg. And the cat, the changes that we saw in the cat, the abdominal effusion and the biochemical changes that I haven't mentioned initially, resolved. And then the last cat was a 6-month-old female entire British Shorthair. This is actually the cat from the first case. So this cat was diagnosed with FIP, and she presented to us 2 days after finishing the course because she became acutely lethargic and hyporexic, and on examination we found that she had a mild pyrexia. So this cat was very, very dull, but we did bloods and we didn't find anything in hematology and biochemistry, so her bloods were completely normal. We repeated an abdominal ultrasound, although this was 3 months down the line, and we didn't find anything. There wasn't anything remarkable there, no fluid. So what would you do in this case, or what did we do in this case? So we use treatment again as a diagnostic tool. We had discussions with the carers about pursuing further diagnostics and the challenges that we have in a cat without effusions and without changes in abdominal imaging, for example. And we decided to restart the treatment with the GS tablets. And what we did was we increased the dose. So we went for a 20 mg per kg total dose divided in 2 doses. This worked out around 12.5 mg per kg per dose BID for this cat. The pyrexia resolved quite quickly in less than 24 hours, and then her demeanor and her appetite came back 2 days later. And the plan for this cat, which we are still treating, is to continue the treatment for 12 weeks. So at the moment, there are no other recommendations for the treatment of cats that relapse. Well, there are some recommendations, but there's nothing that has been trialed and that we know it's a good alternative. So one of the options is to treat the cat with melfloquine, which should be here. It's another one of the nucleoside analogs. So you can combine therapy or switch to that. You can also go for that one if finances don't allow the treatment with Remdesivir or GS tablets. And then the other thing that has been tried, although not in cats treated with licensed GS, or Remdesivir, is molnupiravir. This has been used in cats that relapse, and it has been shown to be successful. The thing is that is at the moment not licensed for cats, but it might come our way in the future. So that's it for me. These are some of the cats that we have treated. They are not all of them. Some of the cats we didn't have pictures of, some cats the carers hadn't consented to us sharing them, but these are some of the ones that we have helped so far with this drug. So thank you very much for listening to me.